Hello to you all. I'm Dr. Farzana Al-Sayed. I am consultant neurologist and clinical neurophysiologist and movement disorder specialist, and welcome to the talk about multiple sclerosis. First question was, what is multiple sclerosis? Multiple sclerosis is the disease of the central nervous system, and when we talk about the central nervous system, it's the brain and the spinal cord. And what happens exactly, it is actually inflammation of the covering of the nerve sheaths. So it's basically the nerve sheath that gets inflamed. So if we have, for example, a nerve which controls our sensation, if it is inflamed, you get sensory symptoms. You get numbness, tingling, or loss of feeling. And when it affects a nerve controlling our motor function, the person gets weak suddenly and cannot move one of his limbs, or maybe even just the lower limbs or the upper limbs. And when it affects the nerves controlling the vision, so it can cause blurring of the vision, or it can cause double vision or painful eye movements. So it depends on which nerves get affected. So multiple sclerosis, as we mentioned, it is a disease of the central nervous system caused by the inflammation of the nerve covering. And when the nerve covering is inflamed, the speed of the electrical impulses traveling through that nerve becomes slower. So that's why we get the symptoms. Now, talking about whether MS is genetically inherited or not, there is a subtype of MS which is genetically inherited, but most of the MS cases are environmental in origin. So basically, it is factors related to the environment of the patients. There are hypotheses saying that it might be related to exposure to certain viruses, and people who have MS, because they have lower immune system, they are more at risk of getting this type of inflammation of the nervous system. However, there is actually a group of MS which is genetically inherited, and it tends to run in families, and we do see that also in the Kingdom of Bahrain. About the signs and symptoms of MS, again, it depends on where exactly in the nervous system multiple sclerosis is affecting. If it is affecting the nerves controlling the eye, the patient will come complaining of blurring of vision. Sometimes they cannot perceive the red color as red, so they see it as pinkish in color. Sometimes they would have painful eye movements, or they might have double vision. So these are if the symptoms are related to a problem with the optic nerve. However, if it affects the sensation, the sensory nerve, people will be complaining, or the patient will be complaining of numbness or loss of sensation, and sometimes painful tingling, which we call it paresthesia. So it could be also giving this kind of symptoms. However, if the patient has motor system involvement, this is when we get the weakness associated with MS. So some people will present with unilateral or one-sided weakness of the upper and lower limb. Some people would get affection of the lower part of the body. Some others actually would present with balance issues, because the balance centers in our brain are affected by MS plaques. So it all depends on where exactly in the nervous system. Some patients might also present with lack of bladder control, and that's because the nerves controlling our bladder and bowel functions also, they might be affected. Now, other symptoms which might not be directly related to MS, but again is seen with MS, is depression. So depression tends to be high. About 20 to 30% of people with MS might suffer from depression, and interestingly, sometimes we discover the depression before we discover the MS. So after we do the scan, we realize that, okay, this patient had MS, and that's the reason for his depression. Number two, they would have some problems with concentration. So it is very common that having some problems with short-term memory especially, and some concentration difficulties, so that's common as well. Other symptoms related to MS are spasticity, feeling stiffness or cramps in the limbs, and usually they suffer from the cramps usually at night when they are falling asleep, and sometimes it awakens them from night, and we can treat that and modify it with medication. When we come to the question whether stress makes MS patients worse, I have to mention that MS is not caused by stress. Stress definitely makes MS worse, and we see a lot of cases who have exacerbations or relapses of MS because they have underwent stress. And when we talk about stress, it's either physical stress or emotional stress. It doesn't have to be necessarily emotional. So physical stress, excessive physical activity can exacerbate or cause an attack of MS, and even emotional distress. The medication options to treat MS, we have to mention that unfortunately up to now we still don't have a cure for MS or multiple sclerosis. However, there are a lot of medications called disease-modifying agents. Disease-modifying agents means that these medications actually tend to improve the symptoms of MS, reduce the number of attacks, and also reduce the number of white spots that we see in the brain or the spinal cord. So it's important to think about the disease as actually there's a lot of progress in it, lots of research, and we are very optimistic that finally we'll reach to a solution for this disorder. However, up to now, we have to mention again that these are all disease-modifying agents. So if we talk about the disease-modifying agents, we started initially with having injectables, so injections, and the injections are variable. There are injections which are used once a week, there are injections which are used 3 times a week, and the injections which are used every other day or even every day. Now, the choices, it all depends on the condition of the patients, the acceptance of the patients, if he's accepting to take these injections, and it's going to be lifelong treatment until we have a final solution for MS, and also at the same time the doctor's preference, what he thinks suits this patient more, depending on the number of attacks the patient is having and the number of the white spots that we see in the brain and the spinal cord. So we cannot say that one injection is better than the other. It's the preference of the patient and the doctor. They sit down together and discuss, and the options come after the discussion. Now, the other actually latest treatments we have, there are also oral treatments now. We have tablets that have been used to actually reduce the frequency of attacks and reduce the disabilities. And with these tablets, there are multiple. Again, every treatment has its own side effects, so we have to discuss with the patient and prioritize which one is more important. Could the patient tolerate the side effects, and does he really need to be on this type of treatment? For example, some of the oral treatments are contraindicated with pregnancy, and we have to sit down with the patient and mention to them about the risks that happens with pregnancy. And just to let you know, all the treatments that are available currently for MS, all the treatment of disease-modifying agents, still yet we cannot actually tell the patients that they could get pregnant easily on it. We have to wait and stop the medications during pregnancy. And there are alternative treatments, and we also tend to always encourage our patients with MS that treatment of MS is not just the medical treatment we provide, it is also that they need to modify their lifestyle. It means they have to engage in physical activity, for example, doing yoga exercises, working with doing Pilates, stretching exercises, especially with people who have balance disorders or gait unsteadiness. We prefer to do physiotherapy therapy and occupational therapy. So that's an important part of the treatment of MS, that we should take it as a part of the treatment. Then it comes the issues of dealing with the associated symptoms with MS. For example, patients, as we said earlier, they might suffer depression. So this has to be addressed and has to be treated. If a patient has spasticity or stiffness of the muscles, we can help them with treatments that they take at bedtime to actually give them a comfortable sleep. If the patient suffers bowel and bladder symptoms, for example, bladder incontinence, we could give them medications to control their bladder much better. So it all depends on the symptoms that the patient has, and we have to address this issue with each single clinical visit. So the advice I would like to give a patient who has been recently diagnosed with MS, I would say, first of all, do not panic. Multiple sclerosis is a disease that you can live with, and you can live a normal life provided that you take good care of yourself and you follow the doctor's notes, and at the same time try your best to remain on your medications, because it is a disease that actually might cause disability if it was not addressed and if you are not following regularly with your physician. So again, we have to emphasize that it is not a disease that harms you. It is a disease that you have to live with. I consider it as like treating diabetes and high blood pressure. It's a disease that you have to live with and accommodate yourself with. If we talk about the clinical progression of multiple sclerosis, we have to mention that there are 3 types of multiple sclerosis. The most common type is the relapsing remitting form of multiple sclerosis. When we talk about relapsing remitting, it means that the patient in between attacks is fine and okay and he's normal. However, in between, during the attacks, he might have symptoms. And once we treat the attacks with the steroids, the intravenous steroids, they improve completely and they get back to their normal state. However, we have to mention that people with relapsing remitting MS might end up progressing gradually. For example, if they have an attack now, they might not completely improve after the attack. Let us assume this patient had weakness of his right side of his body and he was given steroid for this attack. Some patients develop residuals, so they have some remnants or remaining symptoms after the MS attack. So in this case, this might progress and stay with the patient later on. So we call this a secondary progressive type of MS. So they gradually progress and they secondarily become progressive. However, there's a group which is called primary progressive MS, that they start from the first attack badly. They have a bad attack, they have severe weakness, severe loss of balance, and unfortunately they progress much faster than the relapsing remitting or the secondary progressive. We have to talk actually about multiple sclerosis and pregnancy. We tend to say always, and the studies have shown, that pregnancy itself gives the patient with MS some immunity against the attacks. So that happens in the majority of the cases. So we actually tend to sometimes tell our stable patients with multiple sclerosis that they could get pregnant because it provides them immunity for a while. However, we tend to worry slightly after the pregnancy is over. Why? Because there is a chance or tendency for relapse after the delivery. So we have to be very careful after the delivery. We have to monitor the patient, examine them regularly, make sure they do not develop an attack. I have to mention also one thing about pregnancy and MS is we tend to stop all treatments when the patient is pregnant, and this is a must because we don't know whether these medications have any teratogenic effects on the baby. At the end, we would like to be very optimistic about the future of MS. There are lots of research which are going on currently, and they are promising to start with. There are stem cell research going about MS, the treatment of MS, and there are other medications which work actually at the level of the interferons and the immunoglobulins as well. There are some cytotoxic drugs which might help in the future. So there are lots of studies which are in the pipeline, and we hope that optimistically we're looking into a better future for MS. So patients with MS should be very, very optimistic about future treatments. So far we have progressed. It used to be only that we had the injectables or interferons. Now we are up to the era of having oral medications as a treatment, and we hope coming up we're soon going to have a lot of intravenous treatments which are going to be very effective for the treatment of MS.